Morning, my name is Francisco Ruiz. I'm a veterinarian and epidemiologist working at the Spanish Game and Wildlife Research Institute. And my main research line focuses on understanding ecology of vector-borne pathogens as a means to aid in the prevention of occurrence of vector-borne disease in humans and animals. So as many of you know, zoonotic diseases are caused in humans and animals by pathogens that are shared between animals and humans. And especially within the zoonotic component of the circulation of these pathogens in animal populations, the ecology of the health of the environments in which these animals live is extremely influential in the risk of transmission of these pathogens and the occurrence of diseases. So healthy environments are essential for any of the different components of human and animal health. So promoting the health of the environments and healthy environments is essential for human and animal health within a one health framework approach. And in relation to infectious diseases and emerging infectious diseases, the landscape immunity paradigm is nicely highlighting how healthy environments buffer and promote the uh, circulation of different infectious pathogens within the limits that avoid them to spill over to different hosts and become the causes of emerging epidemics or pandemics of infectious disease in animals and in humans. And we are aware how relevant zoonotic diseases are for human health because most of the infectious diseases of humans have an origin in animals, and we know that most of the pandemics that are affecting the humankind have been caused by zoonotic pathogens, including the HIV pandemic. So in 2008, Kate Jones and colleagues made perform a nice review of the emerging infectious disease events that have occurred in the world in the last 4 or 5 decades of the 20th century, and they realized that most of the pathogens that were causing these emerging infectious disease events have an animal origin, and indeed most of them were of or had an origin in wildlife. And they also realized that many of these pathogens were transmitted and maintained by arthropod hematophagous vectors such as fleas, ticks, or mosquitoes. Indeed, this very nice review on vector-borne pathogens it shows how the number of cases are caused worldwide by different vector-borne diseases have been increasing over the last 30, 40 years in many areas of the world. This is indicating how the changes are becoming a threat to the global health. And in it, we know that some vector-borne diseases, such as malaria, are extremely impacting the health of humans in tropical and subtropical areas of the world, where it causes hundreds of millions of cases every year and thousands of hundreds of thousands of deaths, and this is causing severe um, impacts on the not only in the health but in the local economies in these areas of the world. But it's not only human vector-borne diseases that are causing devastating economic effects. Also, some of these emerging infectious vector-borne diseases affecting only animals, such as bluetongue, are also causing devastating effects in the countries where they are becoming established. And in Europe, since the beginning of the 21st century, different serotypes of bluetongue virus have established, causing the death to millions of sheep and cattle and devastating economic losses to the livestock industry. But for every sick animal or human that we observe, there are lots of them that have been infected by vector-borne pathogens that are not showing or manifesting any clinical evidence of infection. So these sick individuals are just the tip of the iceberg of what's going behind with vector-borne pathogens. And this is extremely relevant to understand because this is a nice sample of how relevant it is to understand the ecology and the distribution of vector-borne pathogens instead of vector-borne diseases. Because Crimean conglomerate fever is a disease that has not been reported in humans in France, but French colleagues recently found that the virus is circulating in wild and domestic ungulates in southern France, which perhaps in the future is promoting the potential occurrence of human cases in this area. So knowing the circulation of this pathogen before the emergence of the disease is extremely relevant to start promoting prevention. So these frameworks, it's nicely shown in this chart, which is showing how the complexity of the ecology of vector-borne pathogens needs to be understood to be able to assess properly which are the spatial and temporal risks of emerging of vector-borne diseases and or implementing or trying to implement prevention and control strategies that increase the probability of occurrence of these diseases. But obviously, there is a wide diversity of scenarios in which the drivers of the ecology of these pathogens can be variable. And this was an example of West Nile virus. And you can see here how different the scenarios could be in different areas of Europe where the virus could be present. So in southwestern Iberian Peninsula with 3-4 different vectors, the scenario is completely different to the scenario in Scandinavia with only one vector. And the same is occurring with the climate and the environment. So this is showing us the complexity of the ecosystem in which we can observe variation in the predominant drivers of the circulation or the prevalence of vector-borne pathogens. So it is extremely relevant within this framework that we understand locally and both local and regional and also at larger spatial scales, which are the proximate and ultimate drivers of the emergence of these vector-borne pathogens. And what I used to show my students is that the spatial scale at which we are interested in identifying the drivers of vector-borne pathogens matters. So at the large spatial scales in which vectors are highly sensitive to environmental climatic conditions, the climatic drivers are extremely relevant in shaping the distribution of pathogen, but at smaller scales within favorable or marginally favorable climatic environments, the local conditions of the environment, or sorry, the habitat, or mainly the distribution and abundance of hosts is shaping the distribution of these vector-borne pathogens and the risk, identifying the areas of risk and the risk of transmission of these pathogens. So in the following slides, I'm going to focus on showing some samples of diseases that are probably threatening to emerge in Europe or that have already emerged and colonized some areas of Europe and then further into a spread within the continent, causing severe health trouble and economic losses. And in this nice review, you can see how recent is the establishment and spread of the pathogens causing different vector-borne diseases of high health impact. And most of the events of establishment and spread of these infectious diseases have occurred in the last 10 to 5 years, which is showing the current scenario for Europe. The first example that I'm showing you is dengue. Dengue is a tropical vector-borne disease in which mosquitoes and humans are involved. or different serotypes of the virus are circulating in many areas of the world, mainly in the Americas and Southeastern Asia. And the number of cases in the last 30, 40 years of dengue have increased dramatically in the world, as well as the number of deaths caused by this vector-borne disease. So in the European Union, we have already had autonomous cases of dengue in some countries in the Mediterranean basin. But this is only, as I said before, the tip of the iceberg of what's going behind there. And obviously, we are receiving thousands of imported cases from endemic areas of the world every year. So lots of people traveling abroad Europe and return to Europe infected with dengue virus and potentially transmitting the infection to local competent vectors such as the tiger mosquito, Aedes albopictus, that is currently spreading in Europe. And well, the global assessment of dengue transmission and the future climate change scenarios is showing us that southern of Europe is under a high risk, not as high as all areas in the world, but at a high risk of becoming endemic in the near future. And for dengue, in which there is not an animal component involved in the maintenance and transmission of the virus, just humans who keep and maintain, who maintain and transmit the virus to the mosquitoes. It is mosquitoes in which we need to put attention because mainly in Europe, Aedes albopictus mosquitoes have been increasing in distribution and abundance in many European countries, and you are still advancing and colonizing new areas. So the potential for dengue becoming established in endemic in many European countries is high. But obviously, it's not only a matter of the distribution and abundance of mosquitoes for them to become established. And this very nice model that was carried out to assess the risk of establishment of dengue in Spain shows how relevant it is to understand the ecology of dengue virus. So the mosquitoes, the people traveling from endemic countries, and the number of the frequency of interaction of dengue cases to estimate risks of establishment. And obviously, these spatial risk assessment models need to be revisited from time to time because all these systems are dynamic and Aedes albopictus mosquitoes are spreading and colonizing new areas in southern Spain. Most probably in the future, they will colonize almost the whole country. The next example is West Nile fever, which is a virus, a flavivirus transmitted by another group of mosquitoes, in this case by Culex mosquitoes, especially by Culex pipiens, which is the most widespread mosquito species in the world, with different subspecies distributed almost worldwide and extremely abundant in many areas of the world, not only in the tropics, but also in temperate areas of the world. So this virus of African origin has spread almost all over the world, and currently it is present in a high number of countries, almost every country in America, in the American continent, and Africa, and spreading in Europe and Asia and Oceania as well. Within the European Union, West Nile fever is still emerging infectious disease of animals and humans. And you can see how many countries have been affected by the different lineages of the virus that have been introduced into Europe in the last 3-4 decades. And currently two main lineages, like lineage 1 and lineage 2, both of them causing severe meningoencephalitis in humans and also in horses, are circulating in many different European countries. In contrast to dengue virus, West Nile fever virus is a zoonotic virus, which is maintained in the wild birds, in many different species of wild birds, mainly passerines, but not only passerines. And it is maintained by different species of Culex mosquitoes that bite birds that are able to replicate the virus and from time to time are able to transmit the virus to dead-end hosts, which are suffering the clinical effects of the infection, as clinical cases of meningoencephalitis of horses and humans are dead-end host. Many birds also experience severe clinical manifestations of West Nile fever virus infection as well. Well, in Spain, that we are currently experiencing, we have an emerging scenario for West Nile fever since 2004, in which we had the first cases in animals, and from 2010, with the first human case, we have already reported close to 300 human cases with um, uh, not high, but a relevant number of casualties. So some colleagues try to promote prevention of West Nile fever in Spain by identifying what are the drivers of the occurrence of human and horse cases of West Nile fever. And according to this, they depicted this nice risk map. But the problem with these risk maps based on the occurrence of cases, clinical cases, that we are leaving behind the high number of non-clinical cases that have been infected by West Nile fever virus and that have gone unnoticed. And indeed, the different studies, serological studies that we have carried out in birds, or potential circulation of the virus in bird species, in ungulates, in all a wide array of hosts for the Culex mosquitoes that maintain and transmit this virus, are showing us that the virus is circulating in many different areas of Spain, and these areas could be relevant in the future for the emergence of West Nile fever in humans and horses. So understanding the ecology of the virus rather than of the disease is helping us in preventing new cases in new areas of Spain and Europe in the near future. And indeed, according to this risk map, many areas on central, south central Spain would be under low risk, and when we carry out serological screening surveys of flavivirus, West Nile virus in wild and domestic ungulates in this region, we observe that different areas which are not predicted of being at high risk are indeed areas of high risk of circulation and potential emergence of West Nile fever in the nowadays and in the near future as well. So related regarding the drivers, as I previously said, they are highly variable in space and time, but obviously mosquitoes are highly dependent on temperatures, and the virus in mosquitoes is highly dependent on the environmental temperatures. And what we have observed is that in central Spain, where the incidence of new cases of infection in wild ungulates, such as the red deer, which you have down in the chart in these spot lines, have increased in time from 2005 to 2020. And we observe how this red line, which is the winter temperature, has changed in this area for the last 20 years. And the years in which we had higher circulation of the virus were years in which the winter was smoother in temperature. So the winter severity was much less severe than it was in the former years, where there was almost no circulation of virus. And this is properly related to the ecology of the virus and the ecology of its vectors. Surviving or not the winter is extremely relevant for the virus to spread during the season of mosquito activity. Well, an all relevant, extremely relevant viral hemorrhagic disease that have emerged in Spain and in other countries in Europe is Crimean Congo virus. In this case, a virus that is transmitted by ticks, mainly by high aloma ticks, that are ticks present in Southern Europe and in many countries in Asia and Africa. And there have been very severe outbreaks in Turkey since the first cases were reported in 2002 till nowadays. There have been almost 18,000 human cases of Crimean gonorrhea fever, with close to 820 people dying from it. And this is also a zoonotic virus in which many mammals are involved in the maintenance and transmission of the virus to the vector, to the tick vectors, and birds also not being relevant reservoirs for the virus and transmitters of the virus. They could also have a role in transporting infected ticks to very long distances. So in the Iberian Peninsula, the first evidence of the virus was in 1985, where two patients were found with antibodies against CCH virus in southern Portugal. It was not until 2010 in which we found the virus in ticks coming from red deer. And it was not until 2016 in which we had the first case of Crimean gonorrhea fever, severe case in Spain. Since then, we have had 20 cases in Spain and Portugal that were primary cases caused by tick bites, with 7 casualties, which is a high lethality currently reported, or case fatality rate currently reported for Spain. Well, the first evidence is the first studies that were carried out by the Ministry of Health showed that a Hyaloma staticum, which is a autochthonous Hyaloma tick in Spain and Portugal, were apparently involved in the maintenance and transmission of the virus. And we knew from previous studies that wild ungulates, especially red deer and wild boar, were extremely relevant hosts for Hyaloma staticum ticks. So what we performed was a screening, serological screening to detect antibodies in exposure to CCH virus in wild boar and red deer. And from this, we were able to identify the drivers. The main drivers are the national scale or Iberian scale, and create these maps, these predictive maps of where there was a high risk of circulation of CCH virus and a potential high risk of occurrence of cases. And indeed, most of the human cases have occurred within these areas that we predicted as of high risk. So this is the most updated map of exposure of animals to CCH virus that we have, and was recently published by the Ministry of Animal Health and Agriculture in Spain. And it is showing us that the more or less the same pattern that we observed in previous studies, with the exception of 3 human cases that occur locally in northwestern Spain, and in which we carried out studies and found that probably other tick species could be involved in the maintenance and transmission of the virus. And then there are competence studies carried out, experimental studies carried out in samples of these ticks that are demonstrating that these ticks could replicate and transmit the virus. So it is relevant that we consider not only high element ticks to be involved in the cycle of this virus, but also we cannot avoid having into consideration that ticks, high element ticks infected with CCH virus are brought annually on migratory birds arriving to Europe from Africa, and these birds are also carrying over European ticks with European pathogens to Africa on their way back in autumn. So it is estimated that around 2,100 million passerines and near-passerines birds arrive to Europe in every year from sub-Saharan Africa. And from studies, we know that around 4% of the birds are carrying Hyaloma ticks, and they carry around 2.5 ticks per bird. So according to these rough estimates, show that around 200 million Hyaloma originating ticks could arrive to Europe every year. And expecting a 1% infection prevalence in these ticks, we could expect around 2, 3, 4 million infected ticks arriving from Africa every year to Europe, which is showing us the high infection pressure that we are having of coming from this natural pathway. And indeed, we recently found that according to what has been observed with human cases in countries, endemic countries such as Turkey. We are observing variation, interannual variation in the incidence you have in red in this chart, and this is been studying a serious study in red deer, and we observed how the incidence in yearlings, in red deer yearlings, changes from year to year in this region of Spain, and we also observe this in all regions of Spain, which are showing us that obviously there are not only drivers of the spatial distribution of the virus, but also drivers of the temporal distribution of the virus that are maybe related to the occurrence of human cases. And we need to understand which drivers are influencing these patterns to better prevent human cases. And the last of the infectious vector-borne diseases that I'm showing here, it's leishmaniasis, which is virus caused, protozoan disease, parasitic disease that is transmitted by some flies, different species of dipterans that are widespread in the world, and even though being neglected human and animal disease in the world, it's disease that is widely distributed, one of the most widely distributed vector-borne diseases in the world. In Europe, the main causal agent of leishmaniasis in humans and animals is Leishmania infantum, which is widely distributed in the Mediterranean basin and spreading farther north, causing cases of cutaneous and visceral leishmaniasis in humans and animals, mainly in dogs. Well, the domestic dog, has been thought as to be the main reservoir of Leishmania infantum for the some flies that can later transmit the pathogens to humans and cause human cases of leishmaniasis. But recent evidences are showing how many other wild species and also domestic species could be involved in the ecology and the cycle of Leishmania infantum and become reservoirs and relevant reservoirs of this pathogen for humans. And indeed, studies that we have carried out in and wild carnivores have demonstrated the widespread distribution of Leishmania infantum infection in wild carnivores in Spain, and the outbreak that occurred in Madrid, in one of the neighborhoods of Madrid city in central Spain from 2009, with around 800 cases, and most the major outbreak of human leishmaniasis reported ever, showed us how other vertebrates such as hares and wild rabbits were relevant in the maintenance and transmission of Leishmania infantum to humans, and whereas dogs were not involved. So this was a change in the paradigm of the reservoirs of Leishmania infantum for humans in Europe. And we recently have carried out a study in zootic hotspot with 2-3 deaths, human deaths caused by visceral leishmaniasis, and we have also evidence that rabbits were extremely relevant in the ecology of the pathogen and the word of high risk of transmission of Leishmania infantum to humans. So actions that were taken in relation to this scenario were essential in decreasing the number of cases that were observed in this town. And recently in central Spain, a study that we haven't published yet, we have carried out risk study to estimate the drivers of the occurrence of human cases of cutaneous and visceral leishmaniasis in a region in south central Spain. And amongst the different series of climatic and non-climatic factors that we have included in the risk models, we have found that the abundance of the main vector, Phlebotomus perniciosus in Spain, and especially the potential abundance of lagomorphs, such as wild rabbits and hares in the area, are related to the occurrence of human cases. So this also is changing the paradigm of the domestic dog being the reservoir of Leishmania infantum and the main target for preventing human cases of leishmaniasis. And that's all from my side. So many thanks.